Hi, welcome to This is Getting Old. I'm your host, Melissa B., PhD, and today we're going to be talking about having COVID conversations with your older relatives. And specifically in this episode, we'll talk about the different types of risk, how do you recognize risk factors, and also how do you recognize symptoms because they do show up differently for older adults than they do in younger adults. So COVID-19, when they say the word, it's a novel virus, a novel coronavirus, it just means that it's new. We haven't seen it before. We've learned a lot about it over the past couple of weeks to months about how it's spread, how it's transmitted, and things that we need to do to keep ourselves safe. We also know that it's highly contagious. So it was initially called the coronavirus of 2019, then it got shortened down to COVID-19. If you're on social media, it's hashtag COVID-19. But there are two different types of risk that we need to think about for older adults. They need to think about their risk for exposure, but also their risk for severe illness. So risk for exposure just has to do with, right now we have cases in all 50 states, and that if you're living in a community that has a higher number of cases, it can spread much more quickly and easily in your community once it shows up. But the other risk factor for older adults is their risk of developing severe illness. And when I say that term, what I mean is that they have a higher risk of being hospitalized, having a complication from COVID, and they have a higher risk for dying. So what are the things that make people at higher risk for severe illness or up in the hospital with a complication or possibly dying? So the first two I think are easy to recognize. If you're 65 or older, you're at higher risk, but not all 65 and older adults are treated equally. So when you think about normal aging doesn't have a normal trajectory of decline. A lot of that depends on your lifestyle choices. Did you eat right? Did you exercise? Did you smoke? Did you drink? Did you get enough sleep? All those things are within our control, and everybody does them a little bit differently. And so as people age, there's so much difference between older adults that age really isn't the only thing you need to think about. You have to look at age plus what other chronic conditions that person has. Obviously, another easy thing to pick out is if you are in a nursing home, you're at higher risk for having severe illness and for dying. And that's because people that end up in nursing homes are the most frail and vulnerable of all of our older adults. I think there's been this parallel outbreak of ageism while the COVID pandemic's been going on. Most adults, 95% of adults over the age of 65 are living in the community. At any given time, only 5 to 6% of older adults are in the nursing home. By the time you end up in the nursing home, you are very frail, very debilitated, and you've probably already exhausted all of your financial resources. So that is why they are the highest risk population for not surviving this disease. There are other bad things that are happening for these older adults in nursing homes. We'll talk about that later. So now let's talk about the risk factors that are risk factors for anyone with these conditions. Age doesn't matter. And these are things like having a chronic lung condition. So do you have emphysema? Do you have asthma? Anything that affects your breathing, that's going to put you at higher risk. The one I think that a lot of people don't understand that we say all the time is that you are at higher risk if you have heart disease. And I know, like in my family, my great-grandmother ended up dying of heart failure, and she's like, "Oh, I didn't know I had heart disease." And she'd been taking blood pressure medication for years. So high blood pressure, high cholesterol, any type of arrhythmia, those are things that are considered heart disease if you've had a heart attack before or a stroke. So there's a lot of different things that fall under that category. So if you're not sure, you need to look up, what are all the different things that could be considered heart disease. Also, if you have a BMI of over 40, and there are BMI calculators, but if you're overweight, that's going to increase your risk. Also, anybody that has an immune system issue. So if you are on chemotherapy, or you have HIV/AIDS, or if you've had a bone marrow transplant or an organ transplant, these are things that are going to increase your risk. Also, if you have issues with your liver, chronic kidney disease, or if you're on dialysis, those all increase your risk, or if you have diabetes. So I think some of these risk factors for all ages are harder for people to get a handle on, to know who's at greater risk. But age in and of itself is not the only thing that puts you at risk. So how would I know if I had multiple chronic conditions? Well, here's an easy way to figure that out. Do you take more than 2 medications for 2 different things? So if you take a pill for your thyroid and a pill for your blood pressure, you have multiple chronic conditions. This is you. And so I think that this is one of those things that people often have a hard time recognizing. Healthcare professionals and the media throw these words around all the time, but that's really the quickest way to know. Look at what prescription medications you're taking, and over 50% of older adults take 4 or more medications. So what you need to do is called a medication reconciliation. You need to look at your medication list, and you need to know what that medication is. You need to know what it's for. And if you don't know those 2 things, you need to contact your healthcare provider so that they can help reconcile those medications. It may be that you don't need that medication anymore. Maybe they thought, so knowing what medication you're taking and what you're taking them for will also help you perhaps get rid of some medications, but also be very clear about if you have more than one chronic condition. And older adults, historically, no matter what the natural disaster has been, they've always been the most susceptible. So what we have to do is balance their independence and their autonomy with the restrictions this pandemic is putting on all of our lives, and to do it in a way that's kind and humane. So now let's talk about the symptoms of COVID and how, what we've learned since the middle of March about this. There's a much wider range of symptoms that can mean you have COVID. Primary symptoms people think of are fever, cough, and difficulty breathing. But there are other things. You can have chills, you can have muscle aches, you may have trouble with smelling, which I think is a super interesting one. You might have a sore throat or a headache or even muscle aches. So any of those symptoms need to be reported to your provider. If you have an older adult that you're taking care of or that you're trying to stay in touch with, you need to understand that some of these symptoms are going to look different for them. And in geriatrics, we call this atypical presentation of illness. And the quick way to know if you're seeing an atypical presentation of illness is you're going to have this thought that mama's not right today, or Mrs. So-and-so is just a little off today. And in geriatrics, that's a signal to us that we need to go figure out what's going on. Older adults are typically not going to have a fever. If they do, it's going to be considered a fever at 99.6 instead of the 100.4 that a younger adult would exhibit. They may be more tired than usual. They may be sleeping much more. That those 2 things combined could be considered a hypoactive delirium, which is a medical emergency. So if you have someone who's sleeping too much, if they're not eating like they used to, they're not drinking, if they all of a sudden become incontinent, which means that they wet their pants or lose their control over their bowel or bladder, that's what you need to report to a provider, because a lot of older adults aren't going to be able to tell us what's wrong with them, particularly if they have any type of cognitive issues. You have to watch their behavior. So knowing that they're going to present differently with COVID. And then when we talk about, that there's a higher chance of death for people that are over 65, this is basically from 65 to 74, there's like a 3 to 6% increase that you're going to die compared to someone younger. 60 or 75 to 85, it's 4 to 11%. And if you're over 85, it's between 10 and 27% of a greater risk than compared to a younger population. So the good news is, the majority of people that get COVID are going to survive. So we need to continue to do all the things that we can do to keep our immune systems healthy, to reduce our risk of being exposed to this virus, and taking care of one another. So in my next podcast, we're going to talk about how to effectively communicate between the generations, and I will see you then. Thank you for joining me today for This is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel. And if you have any questions or a related topic you'd like to hear from me about, just let me know. Thanks.